Now, this is a picture that makes all the dentists really happy. This is the healthy mouth. You can actually see how end of the teeth, where the gum starts. They're really nice and pinkish, and also has a really very thin knife edge to it. And you can tell it's really nice teeth. This one, compared to the other one, this is actually the gingivitis. What happens is right here, between the teeth, you can see this is swollen. Right here also, this is all swollen right there and right there. In fact, you can even see a little bit of bleeding coming from right there. And this is called the gingivitis. So what causes the gingivitis? It actually, it's a plaque. Plaque is the main cause of gingivitis. And then the question becomes, what is plaque? And plaque is after you eat food. But half an hour after you eat the food, and bacteria in your body actually start eating off of that food and turns that into a very nice thin film of a film called well, it causes a nice film, and it's called a bacterial biofilm, and that is what is called a plaque. And as a byproduct, it produces chemicals and toxins. And when that plaque stays in your mouth for a long period of time, and your saliva has either certain minerals or calcium, and that plaque takes up the calcium and the minerals, it gets really, really hard. And that's what's called the calculus, or tartar. Now this one I don't even have to explain. This is the moderate periodontitis, and this is called the advanced periodontitis. You can actually see all this calculus built up right there. And this one is probably has never seen, this person has never seen a dentist. And you can see all these reddish areas, they're all swollen. You can actually see how these teeth are getting longer and longer. And that's what happens with the periodontitis. In fact, probably these teeth are somewhat loose. Now, what are the symptoms of a periodontitis? Yeah, the symptom usually it comes with the really bad odor. It's a very distinctive odor, and then also the gum itself is very red or purplish. In fact, actually you can see these are really red and purplish there, and also the gum gets swollen up. And as I said before, so I'm sure people you have noticed. Some people are complaining the teeth are getting longer and longer, and the teeth are bucking out a little bit, especially the front ones. And sometimes you start noticing gaps between the teeth, and the teeth start getting loose. Those are the typical signs of a periodontitis. And so what do dentists do to and get rid of this periodontitis? The main goal that we have is eliminate pockets. Pocket meaning there's a space between the tooth and the gum, and that's where the plaque accumulates. And once the pocket gets really deep, no matter what you do, you just cannot clean it anymore, because toothbrush and floss only goes about 2 millimeters beyond the crest of the gum itself. You just cannot get in there, and that's what the periodontists do. And also they remove calculus so they can patient themselves clean the teeth properly. Also any defect of the teeth could be has to be repaired. Either the teeth or the fillings or whatever they have, and that needs to be should be put back into a proper shape, and that makes the patient or yourself and to maintain it really nice and clean by yourself. And once that is done, and there's some controversy about the use of mouthwash. One believes that it does help, one doesn't think so. Because actually once you start taking mouthwash, what happens is that you start killing some of the good germs too. But one thing we do know that sometimes we do prescribe something called a chlorhexidine, but that's given only by the prescription. But what's most important is that you maintain your teeth yourself every day, unless you are married to a dentist who can do that for you every night. At least the teeth should be brushed twice a day, and also they should be flossed at least once a day. And you really should see your dentist or hygienist every 6 months. And by doing so, you know, the interesting thing is by doing just cleaning and seeing your dentist routinely, what happens is all the cavities, and they'll be all taken care of. You won't get as many cavities as you used to get. And not only that, all the modern technology that what the dentists are trying to do right now is replace the teeth. But if you don't lose your teeth in the first place, you will need those things anyway. And it's something really, really quite simple to do. Now, this is a very severe case of a gingivitis. It's called ANUG. It's an acronym for acute necrotizing ulcerative gingivitis, or it's called the ulcer trench mouth. I haven't seen this for the past about 15 years or so. I used to see this quite a bit. I'm not sure why I don't see them anymore. It's a good thing. Once you have this, you will know you had it because it really, really stinks. And it really smells from the mouth. And also, there's a great pain involved. Also, you notice that all this tissue are just sort of dying away. And the treatment is you put the patient on antibiotics, and you follow up with the deep cleaning. And usually, this is triggered by either stress or hormonal change. As I said before, good thing we don't really see them much. Now, there has been some research done by some scientists, and you come to find out that a calcium intake is good for the teeth for obvious reasons, because as Dr. Young has mentioned, it promotes the osteoblastic activity, which is promotes the building of the bone. So that's is really important. Also, there has been some finding about a good oral hygiene can reduce the risk of atherosclerosis. And so we know that keeping up good oral hygiene is very, very important for everyone. So the lesson of the day is just brush your teeth, wash your teeth, and go to your dentist or hygienist every 6 months. It's really simple. And I left some toothbrushes there for you. Just before you go home, take those. And a happy brushing. Thank you.